So Susan, we're in your office and you are a...
Medical hypnotist.
And what is that?
Well, I use hypnosis, which is using the power of the subconscious mind, an altered state. Hypnosis is a calming, relaxed, inner focus state where the mind is more open to the subconscious and more open to suggestion. So I've learned over time how to use a subconscious state, relaxed trance state, to talk to people's mind and body by taking them into that quieter state and making suggestions to the subconscious mind. That's actually the definition of hypnosis, is quiet, relaxed, focused state where the mind is more open to suggestion. It happens to all of us frequently, by the way. You may be in a hypnotic state more often than you realize.
Fantastic. And you must hear so many of people's stories and hear about people's pain. Now, are you in pain?
Fortunately, I am not in pain right now. When I have pain, I do use hypnosis to help it.
And what type of pain do you experience?
Well, the bugaboo of life sometimes is a tension headache. I don't get them often because I have a pretty good life now. But when I get a tension headache and it has that feeling of pain and pounding, I actually have learned to use hypnotic imagery and self-hypnosis to help the headache subside. And there are simple ways to do that. And in fact, I used to do this before I was a hypnotist because I actually knew that if you pay attention to pain, honor it, say I see you, I know you're there, not try to fight it and get through it and take something to make it go away, but say, I honor you, I see you. If you look at it from the inside and say, where is it? What does it feel like? What's the size and shape of it? It begins to be something you can deal with. The size and shape, oh, it's big and it's red. When you use hypnosis to help a headache, once you acknowledge it, honor it, feel it, got the size and shape of it, you can start to shift that. You go, okay, I'll breathe some cooling blue. Let me breathe some blue in. And let me do that for a few minutes and just imagine calming, soothing river of blue entering that size and shape. And it starts to change the intensity of it. You can actually continue working with something like that and then say, well, what if it starts to be the size of a ping pong ball instead of a baseball?
So
You're making self-suggestions.
So as soon as you feel a headache come on, you tell yourself, instead of going to the medicine cabinet to grab Tylenol, you would first...
Well, you know, there's two aspects. Mm-hmm. If I know a headache's coming on, I know something's off in my life. I know I'm worried or stressed or overwhelmed. So, I stop. I go, take stock. Take a deep breath. What are you worrying about? It's only on days when things are stacked up beyond belief. Mm-hmm. Or there's extra pressure on a particular project, or a deadline, or a bad phone call. So I'll stop, I'll assess it, breathe into that, find out, what's causing it if I can, and at the very least, stop to do this breathing and the color visualization. It is remarkable because, of course, I am taking time out. Everybody who's getting a headache should just gift themselves with 3 or 4 minutes. We all have 3 or 4 minutes, but we think we don't. Of just calming, breathing, honoring it, bringing in a new suggestion. So that is what I do. I don't run to the medicine chest, and I try not to. I'm human, sometimes I do. I try not to just keep pushing through.
Yes.
I go, okay, body's telling me something.
When you feel in pain, you honor your pain.
I do. I stop. It's a very wise thing to at least stop, acknowledge it. Where is it? What is it? That gives you an opportunity to change it.
Fantastic. Now you are familiar with pain because you're actually, thankfully, a survivor of cancer, correct?
Absolutely, absolutely.
How many years?
I had ovarian cancer stage 3C, really a mess, in 2004.
2000.
You do the math.
And when you went to your doctors, did they give you any information on how to handle your pain throughout your treatment?
I was not in pain. The cancer did not cause me pain. Unfortunately, ovarian cancer causes all kinds of discomfort, but it was not pain. That's why it's such a difficult cancer to find. It's sort of quiet. Mm-hmm. But treatment, chemo, part of my treatment, and I'm the one who went right into treatment by talking to a hypnotist first so I could prepare my body for chemo and for having that be a cleansing blessing instead of a scary toxin. So I will tell you that as a hypnotist, my first call after I was diagnosed, first call, was to a hypnotist. I mean, I had already been trained in what you do for cancer if someone is going to go into surgery and chemo. And the more you prepare the mind and body, the better the outcome. It's just really nice to prepare. Can you imagine if someone's going into surgery, let's say, and they're going, oh my God, I'm going to die, oh my God, I'm going to die. They need twice as much anesthesia just to calm them down because they're up here. When I work with people with prepare for surgery, which is one of my specialties, they go into the surgical room, to the operating room, with this beautiful music and beautiful suggestions of relaxation and healing and their future that's going to be so calm and better because of the surgery. They need less to knock them out, so there's less difficulties that you can have from anesthesia, and they heal faster. It's a program that's already been studied in many hospitals. It's been around for many years. People heal faster. So my first call when I was diagnosed was a hypnotist.
And did the doctor prepare you and tell you what you were going to feel or how you could recover from your treatment?
Well, this is very early on, you know. As I recall, they break it to you kind of slowly. Mm-hmm. You know, they tell you what you got, and you sort of absorb that, and then what their prescribed treatment is. And then I was like, let me talk to my hypnotist.
Oh, fantastic.
And
how
thank
did it
goodness
help you?
Yeah. Well, first to prepare for surgery and to prepare for chemo, those are two different things. Yeah. Again, if you're driving to your chemo treatment and thinking, oh my God, I'm going to really feel terrible, everybody loses their hair, and this is terrible toxins, it's just a lot more stress in the body than if you're going in with the thought or the image, which is, this is a healing potion that's just going to clean me out so I can start fresh and really heal. And that was my thought. That was my instructions to myself. And that's what I tell my clients when they come to me. I go, you're going to prepare for a healing cleansing. Chemo is a healing cleansing. And I had some side effects from chemo just like everybody else, but they were probably a lot less because of the suggestions I gave myself. For instance, the difficulties that come from neuropathy.
Now, describe a little bit more about that.
I had some pretty severe chemo, and it was only maybe at the end, about 5 months in, that I had this odd tingling and numbing, burning pain. It's hard to understand that numb can also feel painful, but that's what neuropathy is. And as soon as I started experiencing that, I once again did a new hypnotic suggestion CD for myself, because at that point I was preparing myself each time. Now, when it comes to pain, there's a lot of different ways you can help pain. Many. I want to just describe this particular one, but there are so many helpful ways to use the mind to help pain. First of all, the mind is how the body knows you're in pain. It's the body signal heads up to the brain. So if there's anything you can do to distract, shift, or interfere with that surge to the brain, you can actually experience less pain. So I knew that. But I happen to know that when something is a signal pain, like your body really is telling you something, it's not wise to use hypnosis to dull it because your body's telling you something. So you don't want to say to someone who's got a broken leg, I'll put you in trance, you won't even know your leg is broken. Because the body needs for you to get off that leg and rest and go to the doctor and get your leg set. So signal pain, you try not to mess with. Although you might be aware that people often override signal pain. Again, in an emergency, and this is well documented, someone could have a broken leg on a battlefield and finish the battle because their body and mind have shut that gate. They're like, I'm sorry, I'm busy. Someone is injured in a car accident and doesn't even know their shoulder is out of their socket because they're rescuing their baby. And they will not feel the pain. You can close that gate. The body will take care of itself until the emergency's over, and then they're like screaming in pain. So I did know that I could close the gate by using hypnotic suggestion, say, dulling that, almost like closing a door or turning a dial down. Those are the kind of things we do. But it was signal pain, and I knew I had neuropathy. I said, I better do this other important thing.
So you can talk to your body.
Absolutely. In fact, we're talking to the body all the time, but we're usually not monitoring it, and it's usually not very pleasant or positive. For example, when I see someone who's in pain, as a medical hypnotist, people come to me, they're often saying horrific and negative things to their body, like, oh my God, I'm falling apart. Oh, this pain is worse than yesterday. I'll probably have this for the rest of my life. Oh, I think I'll die. I mean, this is we're not in charge of this flow, but we can be. And so, very important to find out what you're saying to your body and whether or not you could change that conversation. So, back to my story of neuropathy, I decided to use body dialoguing, which is, again, a hypnotic state. Hypnotic state is closed eyes, state between waking and sleeping, where the mind is open to suggestion. So the suggestion was, bring extra circulation and extra nutrients to every nerve and cell, all the way down to the tiniest capillaries in the bottom of my feet and hands. You say that enough times, and there's a new conversation going on in your body. Now, it sounds crazy, but it's so doable. I can work with you in probably 5 minutes and have your hands get to feel warm, okay? I often tell my clients that my mother was a great hypnotist without knowing it. Maybe your mom did this too. But on a really cold day, I remember standing with her and shivering in my shoes, you know, on a bus stop. She's like, honey, why don't you just pretend there's a big campfire in front of us, okay? And it's a really warm campfire and it's warming you up. And, you know, 5 years old, I close my eyes and go, oh, yeah, oh, yeah. Ah, and I'm like, warm. How does that happen? It's the power of imagery and what you're saying to yourself. And who knew that was hypnosis? I just remember my mom used to help me feel calm and warm. Well, when you warm a limb, a finger, a toe, a hand, you're sending extra circulation there. So you can affect your circulation. You can affect it to warm your fingers. You can affect it and start to feel it sort of pulsing in there. So I'll never know exactly how much of my work and how much of my body was going to heal on its own. But for the neuropathy, I did a very repetitive CD that just said extra circulation, filled with healing and nutrients and extra blood and warmth to the hands and feet.
And it worked?
Well, I have no neuropathy.
How long did it take?
I can't say I even remember now. It was all a big, long healing blur. But I finished chemo in December 2004, and I was pretty awesome by the middle of the next year. I mean, I was doing everything I ever did. I think I went skiing that year. So, I mean, It's a bit of a blur now.
Did you tell your doctors about how you treated yourself?
I have a wonderful doctor, and she knows I do all kinds of interesting stuff. At the time, yes, I did tell those doctors. Those are other doctors. Yes, I did. And
what were their opinions?
They smile benevolently and go, very interesting. Next, I can't say that they have adopted it for their clients. And sometimes I think, oh, I should just go back there and say, guys, let me help your people. But I'm just very busy.
And you're smiling back at them, right?
Yes, I am.
Saying I'm
so happy to be well. I think it's great to do the best of medical science when it's needed, and alternative therapies when you can be helped by them.
Now, part of living your story, is that why you want to help others?
Oh yeah, oh yeah, oh yeah. Well, I was already a hypnotherapist. I was already a hypnotherapist when I got cancer. I was already on a path to want to help people. This is the most helpful thing I have ever done, was when I learned to calm my own mind. I have a very busy mind, as most people do. So many, many years ago, I studied hypnosis because it had helped me as a younger woman to calm myself, to take control of my habits. And that brings me to another point that does have to do with pain. This is really important. A big component of pain is stress. When the body is in the stress mode, it's different. It's a different chemistry than the relaxation mode. They're different chemistries. And you heal faster when you're in the relaxation mode. It's literally like walking from fight or flight, which is all kinds of hormones and chemistry and even body reactions. In fight or flight, which is the stress, the whole chemistry of it, the blood flow is actually moved from the extremities because, thousands of years ago that helped us. If, a bear was going to bite off our hand, we had less blood there and more blood where it counts to keep us alive right here. So we still have the chemistry from fighting bears, but all we're doing is like fighting traffic and not letting any of it out. So we still have cortisol and adrenaline running through our body, which does not help us heal. It's a different chemistry. Cortisol and adrenaline is fighting chemistry or flight chemistry. Healing chemistry is it's like a different room. You'd be in the healing room has different lovely things flowing through your body. So hypnosis, again, is taking you to that healing room. Every hypnotic session, anytime someone goes into trance of any kind, it's a relaxing thing. And so you're going to be helped by the chemistry. Any person who's experiencing pain immediately feels better during a hypnosis session, even without complicated other suggestions, just by breathing calmly, taking their mind into a happier or calmer or even a more beautiful mental imagery place. One of the things I give every client is a lovely, relaxing image, a place. How does that work? I don't know. But if your mind is thinking of a beautiful beach and you've created it just the way you like it, it's a distraction. It changes first of all, it changes your body's ability to heal, and it changes what you're thinking about. So, two things are at play there. You can distract from pain, which is again sort of closing that gate. The pain might be there, but you're not thinking about it. So it lessens. And the second thing, which cannot be overlooked, is you heal faster. If there's something physically wrong, with many pains, there's still something unhealed. With some pain, it's left over, and it's a byproduct. They're healed, but there's still some pain. But healing works better when you're relaxed. So anyone who's dealing with pain of any sort would be helped by a healing CD or a calming music or a breathing technique.
Just pure relaxing, taking a deep breath and relaxing.
Oh, yes. How hard is it in our lives to take a couple of deep breaths? People don't do it. They go, I'm too busy.
Or they pop a pill or...
Yes.
Yeah.
Well, thank goodness some pills are really important and do work and they're really needed, and I'm all for that. But so much of the time we could be taking care of ourselves without side effects, without addiction, by starting by saying, hi, I hear you, I acknowledge you, I'll take a few deep breaths right now. I often give my clients, especially my pain clients, a counted breath. Just a simple counted breath. It involves mind and body. And that simple counted breath, especially long exhales, have been shown in studies to improve body chemistry, to take you to the relaxation response. So these are things that everyone can use for free.
Oh, fantastic. Now tell me about one of your clients or two, someone who's come to you in severe pain and has had success just by relaxing and stuff.
There's so many different reasons people come to a hypnotherapist. A funny story came to me just before I was going to talk to you about this. A story came to me because a client that I see for other reasons, she was actually coming to me for some phobias. And yet work was very tense, as work can be. So overwhelming workload, a lot of data entry. She came into my office, she said, in the 2 weeks since I saw you last, I got carpal tunnel. It's so bad, I couldn't even type today. I was at work and I couldn't type. She said, and because I work right there at the hospital, I was able to go and see somebody. He said, yes, you should probably get surgery, blah, 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 blah. Her whole story unfolded. Fortunately, she was in my office, and I have such a deep understanding and belief that the body can heal itself that I did something different. I said, before we work on anything else today, let's see if we could take care of some of the pressure on your mind about this overwhelm, and some of the pressure that might be constricting the vessels of your hands. And it is. It literally constricts. So we did a little bit of talking and releasing this boss and that boss, which was important. We all have to do that. Sometimes I like to give my clients a feeling of having a bubble of protection so that people can yell at you, but it doesn't sort of get right into your skin. This is a fascinating and very doable hypnotic suggestion. Again, remember, the body's always listening to the words and suggestions and images in the mind. So, of course, the image she had is, I'm overwhelmed, I hate my job. Who would not when they were being, overworked and too much data processing? So once we changed some of the language that was going on inside, which is, I'm free to come and go, I really love the job. There was a little bit of change in that, but then it was direct body suggestion. And the suggestion is along the lines of those highways, those veins that are literally, feeding those wrists can be opened instead of just the size of a vein. I would say something like, now it's widening, relaxing, more flexible, wider, like the size of a pencil, easily opening, the size of a pen, maybe the size of a garden hose. And even though that's a very exaggerated idea, it tells the body, which is on a microscopic level listening, and on a microscopic level, it opened. And so we did the session, she felt better, but the most remarkable thing is when she got up, she said, there's no pain in my hands, there's no pain in the wrists. How did that happen? And I go, it was tension, it was stress, it was a mind-body dialogue that said, we're tight, we hate this, and we're open, we love life. It's just a really different dialogue.
So instead of having to go through surgery, which her doctors were telling her, or take pain medications in one session,
she actually avoided and canceled surgery. So it's a blessing. Now, the funny thing is, of course, I do a lot of different things as a medical hypnotist. People are coming to me for a lot of things. The top of the line is not carpal tunnel. I wish it was. If I had a relationship where people started knowing that they could send people here. But it's not often that people say, I have carpal tunnel, I'll call a hypnotist. But someday maybe they will.
Or just even to relax and pay attention to the body.
Yes, yes. There are many things like that where tension is a component. Tension and stress is a component of, they say, about 70 to 80% of all illness. So no matter what's going on, use some time, give yourself the gift of some calming relaxation. You can relax with music. Music can put you into a deep, relaxed, and even hypnotic state. Pleasant movies, pleasant television can put you in a deep, relaxed, hypnotic state. Breathing and listening to a very lovely mantra or just counting gets the mind busy and distracted. These are simple, helpful things. And the color visualization I was talking about is just one way that we actually can change pain. Remember, it's sort of amorphous. It's an impression. It's a perception. There are things where you can use hypnotic suggestion and visualizations to, for instance, turn down the pain, like to sense, as if it was a dial, a volume dial, where are you on your pain dial, if 10 is the worst, and teach them to literally turn the dial down. And most people go, oh, that's too easy. And then they do it and they go, oh, it worked. And then you say, oh, well, you could turn it up again. Oh, well, I don't want to. Yeah, but show yourself. You turn it up again. Okay, now turn it down a little further. And the feeling in the body responds to that dial imagery. You could turn it down. You could turn it down.
Oh, fantastic.
That's just one other of many things we do.
Do you deal with any patients who have gone through pain addiction?
I don't.
Pain medicine, sorry, addiction.
I cannot say I have. No. I would love to, but no.
I just want to interject one thing. About the carpal tunnel, was this woman's, I haven't heard of surgery for carpal tunnel, so was she going to have surgery?
Oh, surgery for carpal tunnel is a big moneymaker.
Okay, great. I just wanted to make sure
Yes.
that the one we're editing, that's okay.
Absolutely.
I didn't know that. So,
Oh, yeah.
Okay,
Am I on film?
Mm-hmm.
Oh, I was just going to say, but it's quite common.
okay, great.
Yeah,
I just
they had
wanted to
already
make sure.
scheduled her.
Okay.
Yeah,
Yeah,
it's
okay.
and it's no picnic. You know, we all sign up for some surgery sometimes, and there are alternatives.
Yes.
Are
Does she
you-
have to come to you over like once a week?
You know what? That change was permanent.
one
It
session.
never came back.
Wow. That's-
Because we unearthed the cause. And that's amongst the things that a hypnotherapist can do with pain. One of the important things I do want to mention, because it has to be said, is that there could be emotional, energetic, or hidden causes. And people don't know. Their conscious mind doesn't know. The doctor doesn't know, has no way of finding that out. But one of the things a hypnotherapist can do is use regression to go back to the beginning. When did this start? Why did this start? There are some pains, now I'll give you an example. Some people are really dealing with leftover pain from something that is healed. I mean, people feel pain from an arm that's not even there. You know, missing limb syndrome, phantom limb syndrome. There's literally no arm and they can feel the pain. That's because we have energetic loops in our body. We look like we're solid, but we're really quite energetic. And there is often pain stored or trapped, or emotions stored or trapped, that start the syndrome that then becomes looking like, you know, inflammation or, you know, unbearable heat or tingling or a piercing pain. And people can, in hypnosis, travel back to when it started. Now, I have not had a lot of clients with this because it's a wonderful thing to do, but people don't often realize they should come to a hypnotist. But I have had people come back even to find out that in surgery, when, remember, the body, it looks like it's completely out and unconscious, but the ears are always open. If the mind hears a very negative thing, It can retain something and not heal quite properly. Like if the body was to hear, oh, she's not looking too good, or she's not going to make it. And the surgical room is, a place of free banter from many doctors and nurses, and you can't blame them. It's their workplace. But occasionally there have been cases where something was overheard by the subconscious mind, that harmed the healing, so that there was pain that didn't heal quickly. That's an interesting area, very, very worth looking into. And so when people are in pain and it's mysterious in nature, it's like, doctor doesn't know what it is, I don't know what it is, but it can't go away. I go, let's find out what was happening the day this started. And with most people, hypnosis is a tool that helps you uncover memories. So with most people, they can find out.
So it's going to the source instead of numbing the pain.
Yes. But now that you mentioned numbing the pain, I want to mention that hypnosis can cause analgesia. We can cause numbing. I can make numbing in my hands or your hands or anyone's hands. It's one of the easiest things you could do with hypnosis. You can numb your hand and then send that numbing to put your hand to the mouth and let the numbing just go right into your cheek. And then you have a numb mouth and you don't need Novocaine. Many hypnotists love to do that. They go to the dentist, they go, I'm numb already. And the dentist goes, excuse me? And it turns out you can numb yourself. Analgesia is a body resource that you can create. So that one is fairly common and easy. So one of the ways you can dull pain is by creating analgesia.
Wow.
Yeah.
Because part of our research, dentists are one of the top people who give, pain medication out
Yes.
to patients.
Now, I want to make one thing clear. Not everybody is the best subject for using these kind of techniques. You have to really believe it so that you do it. If you were going to the doctor, the dentist, with your newfound numbness and you thought it may not work, it may not work. Remember, the mind's pretty powerful. Not everybody can focus. And then there's a big chunk of the population who just goes, who cares? There's a pill. Why should I work so hard? And I'm good with that. I am. I like to live side by side absolutely fine. In fact, I don't go and use my own analgesia or anesthesia by hypnosis for dental because it takes a lot of practice and I don't mind Novocaine. If I was allergic to Novocaine, I'd go to hypnosis. Or if there were side effects or addiction, I go, there are so many other ways. So there are times and places and clients who are right for hypnotic pain relief. Anyone who really is interested. Anyone who's, at the end of their rope, have tried everything. Anyone who is, curious about their own power to do it instead of dependent on a pharmaceutical. I have a very close relative who completely has healed from super painful IBS cramps that she had for years, kept getting worse. IBS is terrible cramps and pain in the tummy. And every once in a year I would say, maybe you should see a hypnotist. And she'd go, it's in my stomach, not in my mind. And I'd go, oh, okay. So she was not a candidate. However, when it was so bad that she was like, okay, I'll try hypnosis. Hypnotherapy, which calmed the imagery, brought her to a relaxing place, eased the tension in her body, and no more IBS symptoms. These are the blessings. These are the things you want to tell people about.
So if I came with you, I'm suffering from pain, immediately you would say to me, slow down.
I would say, stop, slow down, let's find out what's going on in your life, and let's begin by taking you from the stress room to the healing room. Let's go right into deep calmness. Let's do breathing. Let's give you a safe place in your mind's eye. Let's bring color, light, and ease into your body. That would be number one.
Fantastic.
And then we would work on specific suggestions depending on whether you need numbness, pain relief, openness, closedness, or just a feeling of well-being.
That's great. Well, thank you so much, Susan. That was really, really good. Yeah.
One other thing that comes to mind is that many times when people are in pain, they feel like they're victimized. It's just like they're under it. And when you learn hypnotic techniques, you're more in charge of it. If you can just turn your pain down even 3%, 3 degrees, turn your dial down from 10 to a 7 or 7 to a 4, it's empowering. And that helps everyone in pain. Instead of feeling like, I'm getting worse, they think, oh, I'm getting a handle on it.
Did you do anything else for pain during chemo?
There was no other pain. Chemo lays you out and makes you lose your energy. So there were other suggestions I used. For instance, suggestions to preserve the healthy cells. Suggestions to have the chemo directed right to the cancerous cells and bypass the healthy cells. Lots of good suggestions, lots of positive suggestions, which I think helped, but they were not pain related.
But going through cancer, you never took anything for pain other than hypnosis?
Yeah, well, except after my surgery, which was a cut from here to here.
Yeah.
That's amazing.
Yeah. I didn't mess with that, actually. I was so out of it.
That's really amazing, though,
Yeah.
knowing other people who have suffered from cancer. It's
Yeah.
incredibly hard to go through that without supplementing it with pain medication.
Well, I don't want to claim anything big there because I didn't have pain so much from the cancer.
Yeah.
And the
it's more
chemo,
the treatment, really.
yeah, the chemo treatment, the only pain was the neuropathy.
That's amazing.
Would you say that hypnosis heals the cause of pain?
Hypnosis does not heal the cause of pain. Hypnosis helps you get into the mind-body chemistry that supports healing, that assists healing, that even enhances healing. And that's proven. That's proven. You can read on about the relaxation response and many, many mind-body books and studies about how being in that chemistry is so helpful for healing. So yeah, it's the tool that gets you to do the healing.